And if you want, you could put me in on it. And I assure you, since it's a WhatsApp group and it is outside of the realm of the school, I wouldn't have any say in it. So you could say whatever you want. I wouldn't hold it against you, and neither could I correct anybody or anything like that in the group. I'll just be there for you to have access to me in the group, but I'll have no authority whatsoever in that group. All right, so if you could include me, that'll be fine. It'll be a great way. And in fact, that's probably the best way to really communicate with me. You know, you could just hit me up on WhatsApp. Yeah, that's okay?
Yes, sir.
Right, so I can give you my WhatsApp number. My WhatsApp number is 266-8770. Yeah, 266-8770. Maybe you want to put it in the chat or that's fine.
No, sir, I get it.
Okay, great. Okay, great. So having a WhatsApp group, that's really great. All right, anything else as related to the class? So we'll be going week to week, and you just look under what the students must do for the week. So review, revise, complete the practice quiz, and complete the worksheet. All right. So next class, they will be going through both the practice quiz and the worksheet. So you're expected to do this before next class day. All right. All right, so let's get into the lecture for today then. We're almost there. You all want a little break before we start the lecture? 5 minutes? Or you're good?
Yes, sir.
Everybody good?
Yes, sir.
Yes, sir.
All right. Okay, great. All right. Hey, my friend. Lakeisha, you good?
I'm here, I'm good.
Okay, great.
I just afraid to talk because it's in my microphone is too loud.
Yeah, you mustn't be afraid to talk, but you just had to turn on the microphone, that's all. Okay.
It's better now?
Yeah, thanks.
Okay. All right.
Hi, sir.
Yes,
Good day.
go ahead. Who's this one?
Misha here. Misha.
Aisha.
Would we be using the
Human form, human function?
Yeah, human
Yeah.
form, human function.
We surely will. Anybody know where to get the book from? I'm sure talk to your friends.
I have a PDF for it.
Okay, there you go.
Oh, that would be good if we could get a PDF, please.
Okay, well,
I'll send it to the WhatsApp group when I make.
There you go. All right, problem solved. All right, so let's start with today's class, shall we? Human form, human function.
So are you speaking? Because I'm not hearing anything.
No,
I'm
not saying anything yet.
Sure.
Okay. All right, so human form, human function, and of course, life. So one of the things with this course, structure and function, as the name implies, it refers to anatomy and physiology. Anatomy, structure, physiology is function. So a nice way whenever you get let's say a question related to anatomy and physiology, and I assure you, this is usually a favorite question that comes as a multiple choice. You know, what is structure? When you look at anatomy and physiology, what do they refer to? All you have to remember is your course, the name of the course, structure and function. Anatomy refers to the structure. Physiology refers to how things are actually functioning. Anatomy, structure, physiology, function. A nice way to remember it, physiology, you know, it has a F sound to it, as does function. So a nice way to remember it. Anatomy is structure, but physiology is function. So when we look at organisms, one of the things with organisms, they have certain characteristics associated with them. And there are four major ones: the organization, metabolism, and adaptation, and reproduction. If I were to ask you a question, which one out of all of these is the most important characteristic of living organisms? What would you say? Remember, always remember there are no wrong answers, all right? And when somebody does give an opinion, we just have to listen to it, yeah? And just appreciate it for it. Okay, so we have one person saying reproduction. Anybody else?
Adaptation.
Adaptation, okay, nice too. Anything else? Metabolism, all right. Anybody else?
Organization.
Okay, so we went through the four. All right, but the one perhaps which is the most important out of the lot will have to be reproduction. And why do you think reproduction, even though all the others are important, right? But more, if you were to argue, you'd say reproduction is the most important, and I'll explain why. What would happen if we didn't reproduce?
We will cease to
Will be
exist.
listening.
Yeah, you'd disappear. You become extinct. I like the use of that word, extinct. So if you cease to reproduce, you'll become extinct. So therefore, all the other things will, well, you wouldn't be able to break down in terms of catabolism or build up things in terms of anabolism as it relates to digestion, or you wouldn't be able, your body system would be of no use because you wouldn't be no longer be there, right? And in terms of adapting to the environment, that wouldn't be necessary because you'll be no longer there. So while all of them are indeed important, you have to remember reproduction, critical, because of the fact if you don't reproduce, you'll disappear as a species. So very important in terms of characteristics, reproduction, and in terms of form and function. The human hand, when you think about it, is very well adapted, and the thumb is perhaps the most important of the fingers. How do we know the thumb is the most important? Well, do we have anybody here who have family or anything working as insurance agents or in the insurance field?
So your thumb is the most insured finger.
Yeah, it is. It's cost the most. So in other words, let's say if you're working in some job in which you run the risk of losing a finger, which job you think you run the risk of losing fingers very easily? If you're doing what?
Carpentry, sir.
Carpentry, yes. Anything else? Cutting meat. You ever watch them people cutting meat? Welding, cutting meat, let's say in the grocery. Anybody ever say, I just be, oh Lord, I'd be trembling just watching them, working with a saw. It's very easy. So let's say you're insured. The one that they'll pay the most for, any insurance company, will be your thumb. And the reason being is because your thumb is really, while the others in terms of movement, the thumb has the greatest degree of movement, and it facilitates you in particular to do a number of things in terms of function. And here we see it grasping a pen. So while other animals do have a thumb, and here below they're showing you the thumb associated with a monkey in terms of the hand of a monkey, it doesn't have the amount of movement capability as the human tongue. And that is why if you look at the muscle associated with the thumb here, it's quite a big muscle because we use the thumb quite a bit. Okay. So in terms of organization, we will mention organization. The body, one of the things to appreciate with the body, your body is a machine.
Hi, sir. Excuse me.
Yes.
One of your students, Sasha, she's currently trying to get back into the class. I'm not too sure what happened, but she got booted out just now.
No, it's okay. Okay, thank you.
Khadija as well.
Yeah, okay, I bring
She
them in.
said
Thank
she's
you.
waiting for you
Okay,
to let
got
her.
it.
Yeah.
I got it. Thank you. All right, so in terms of when you look at the building blocks of life, it relates to the organization of the human body itself. So the human body is very well organized, and at the lowest level, you have atoms. Atoms are associated for molecules. Molecules themselves, they are associated together to form cells. A group of similar cells forms tissues. Related tissues are arranged to form organs, and these organs themselves, they are arranged to form organ systems, and collectively these organ systems form the human organism. How many organ systems do we have in our body? How many organ systems? Anybody? How many organ systems does a human body have? Is it 10, 11, or 12?
So 11.
I think it's 11.
It is indeed. Very good. Very good. Very good. It is 11. We have 11. And a nice way to remember an acronym, to remember it, is unsliced RRM, or unsliced Mr. R. That's UNSLICED RRM. And those are the organ systems of the human body. Let's see if we could go them over. What does U stand for in terms of organ system? Which organ system?
Urinary system.
The urinary system. And what is the urinary system important for?
To get rid of waste, you know.
Get rid of waste. Very good, Lakeisha. And what and you all will see it professionally right now, not only here in Trinidad and Tobago, but throughout the Caribbean and the wider world. We have this big issue related to diabetes. And one of the complications of diabetes, of course, is kidney failure. And you do see in the dialysis unit, you know, I often talk to nurses and they tell me it's backed up. It's always backed up, you know, at the dialysis unit. So we have this big problem as it relates to kidney issues. N.
Nervous system.
Nervous system. Is the nervous system important?
Very.
Yeah.
Very.
What would happen? The nervous system interacts with two other systems to bring about movement. What two other organ systems do they interact with in order that we move? Think about it, your nerves interact with two other things to bring out for you to move.
The muscular system.
Muscular system is one, and one other one.
And the skeletal system.
Thank you very much. Or your bones, yes, your skeletal system, very critical that those three. So always remember, those three, like they go together. Like, you know, it's like a little posse, as it were, right? Your bones, your nervous system, and your muscle. All three of them critical for movement. And which is why for when you have certain issues with your nervous system, right? When persons have MS, for instance, you know, the nervous system is not working, so therefore they lose the ability to move. Right, very important there. So nerve, muscle, bone, they all go together, right? So muscular tissue, well, we mentioned those, but muscular tissue, very important. And when we look at muscle tissue, muscle could only do one thing when it gets a response or a stimulus from a nerve. A muscle could only do one thing. Is it lengthen or shorten? When it gets, you know, when it gets an impulse from your nervous system, would it lengthen or shorten?
Shorten.
Shorten, very good, yeah. And that's the only thing a muscle could do. So when you apply, when the nervous system, as you'll see it when we eventually look at action potentials, when the muscle stimulus is applied from the nervous system, and literally it sends like a current to the muscle. When it receives it, it shortens. And when you remove that stimulus, it goes back to its original length. And that's the only two movements a muscle has, shorten and lengthen. It shortens when it gets stimulus from the nervous system. When that stimulus is removed, it goes back to its original length. And that's all. Then we have the skeletal system, you mentioned that. Is the skeletal system important? What else does the skeletal system do other than interact with muscles to bring about movement? What else does it do?
It protects your organs.
Oh,
It
yes.
provides the body with a framework.
Framework, yes. What would happen if we didn't have a skeletal system? What would we look like?
Jello.
Jello, yeah. Yeah, we wouldn't have no big maxi again because it'll be flat. All the maxi and them will be flat, right? Everything will be flat because you wouldn't have quite a framework to support. So one of the important things with your skeleton, it keeps you off the ground and it supports and protects your important organs. What are some of the important organs in the body that are protected by skeletal tissue? Anybody?
Heart.
The heart.
And the lungs. Your heart.
And what are they protected by? What gives them protection?
The rib cage gives
The
the
rib
heart
cage
and
gives
lungs
it right,
protection.
and then the brain, quite right, the skeleton, right? So your brain is protected by your skull, right? The cranium. You're right, your cranium, very important. So in other words, when you look at your body, to tell which parts are really important, look at the parts or the organs which have bone around them. Those that don't have any bone around them, well, you can do without them. I mean that, loosely, if you were to rank importance, but the really important part, they have bone around them to protect it. But the others, you could lose them and you will still survive. But when you look at your core, your torso, all of those things within the torso, they usually are protected by bone. And when we talk about your torso, we're looking at your skull, your vertebra, and your rib cage, protecting those organs within your thorax. All of those things are really important. When you look at your arms and your legs, well, the tissues on the outside, yeah, you could lose an arm, you could lose a leg, but you'll still survive, right? But it's a big problem if you lose some of the organs within your chest, or most critically, if you lose your brain. Oh yes, the party finished at that point, okay? UNSL, what does the L stand for?
The lymphatic system.
Yeah, the lymphatic system, right? Is it important? Yes. The lymphatic system, that's the repository of your white blood cells. Very important. So these cells associated with protection, particularly now during the time of COVID, right? They reside, your immune system, thank you very much, right? So those leukocytes, they in terms of where you find them is they move within the lymphatic, and then they squeeze through the blood, the spaces between the capillaries and get into your blood system. But their repository is really in your lymphatic. So that is very important now, particularly during the time of COVID. And as we speak about COVID, what could you do to boost your immune system? If you're watching TV, what do they tell you? Especially if you're watching news, TTT. Usually comes along this big ad. What they'll tell you to do. An ad comes on. It's a drug where the last part is XL.
Omega XL.
Right, they tell you about Omega XL, yes. In fact, Omega XL seems to be doing everything. All I would say where that is concerned, always make an informed choice. Listen to what they're saying and do the research yourself to see whether the claims they're making are true or false. But one of the things with Omega, they rarely say it does a whole lot of things. So, as persons of science, it's always good to make informed choices. Don't believe what people tell you, right? But you could do the research yourself and actually come to a conclusion. Let's go forward. UNSLI. What does the I stand for? Which organ system? Integumentary system. And that stands for what? When you speak about the integumentary, what are we referring to?
Skin.
Skin, what else?
Hair, nails.
Hair and nails. Skin, hair, and nails. Is your skin important? Well, yes, usually a body doesn't produce things for waste just because. So the skin is important. What major function does the skin have? Or what does it serve, for you? What was one of the major functions of the skin?
Protect the body.
Protection is one, yes.
Protects your vein and stuff.
Oh yes, most critically. And when would we recognize how important the skin is in terms of protection? And you would see it, let's say if you're in casualty or something, if somebody comes in with what type of injury, and this is when you realize how important the skin is. Something that begins with B. Burn, thank you very much. Yeah, when somebody comes in with burns. And in fact, one of the things, how persons die, one of the major things, let me ask you a question. When you get a serious burn, how is it that you pass away? Is it from the burn itself or from something else? It's something
Infection.
Thank you. And infection is a real bad word, not in the medical field, right? Infection is a bad word, something you want to stay away from, yeah? So most critically, particularly with burn patients, they always try to control for infection. And how do you control for infection? If it's bacteria, right, you're looking at antibiotics, antiviral medication, and of course, because of the fact you don't have skin, you lose a lot of You lose a lot of, since you don't have skin. Something that, blood, okay. And what one well,
Substance.
if it is, one of the things, well, as we know, your body would coagulate the blood into, if you do have damage to those vessels, okay, we're talking about an ulcer developing. I hear what you're saying. Yes. So you could say blood, but usually you try to control for blood in terms of dressing and so on. But what else do you lose through your skin? Your skin is very important. It's something that it does. It protects you from losing what? Your skin. It's a word that begins with M. Or it could be, yes, thank you, moisture. It keeps the water in, right? It's very important for preventing loss from moisture. So one of the things you would recognize, if somebody then has burn, what would they do when they're losing a lot of moisture? In terms of the treatment regimen, what do you think they'll have to do? To give them, put Vaseline, okay, that is one. Anything else? If you're talking about severe burns, what do they have to do when they present in casualty and they get admitted to the ward? What is one of the things they're doing? So they're controlling.
You have to dress it. You have to do proper dressing on it, sterile dressing and stuff.
Sterile, and that is something y'all will learn. You'll probably have done it already, yeah? In terms of aseptic technique, that is critical to keep, everything sterile. That's a very good point you raised there. So in order to minimize infection, you always keep things sterile. And that's very, very, very important. And that keeps the infection rate down. But so the person has presented, let's say, burns to the forearm, severe burn. What would the physician prescribe? Well, usually they prescribe drips, a saline. So it's a way of replacing, assuming I hear what you're saying, sir, but what if their arm is burnt, so you can't find a vein there, but there are other sites in terms of introducing the intravenous drip. So very critical, they have to be giving them, keeping them replenished in terms of that moisture. Now, let me ask you this. What is so important? When we look at our bodies, we're approximately 70% water. Why is this water so important for our bodies? Why? Let's look at the cell, going down to the level of the cell. So if we're looking here at the building blocks, if we come down to the level of the cell, so we're looking at a cell, it has a nucleus, it has a cytoplasm, and in the cytoplasm, it has this liquid, which is mainly water itself. Why is it so important at the level of the cell that you have to have so much water inside of there? A very simple reason, and it has to do with chemistry, something that is usually associated with chemistry. It begins with R and ends with N.
Regulation.
It is. If we don't get a better word, we'll use that one. But let me ask you this. If you take...
Retention.
Say that again?
Retention.
Close.
Retention.
It does end with shun and it begins with R. So what happens in chemistry when you mix two things, let's say sodium and water?
Reaction.
Thank you. There you go. Yeah. Reactions. And one of the critical things to remember in your body, all of the reactions associated with metabolism in terms of breaking down food, building them up, all of the reactions at the level of the cell has to take place in an aqueous environment, right? So one of the things, when you look at the cell, you have thousands of reactions which occur all the time. So for instance, one of them, which you might have encountered, glycolysis, breaking down of sugar to generate ATP, which is energy, the basic unit of energy. So when these sugars are broken down at the level of the cell, all of these have to take place in a aqueous or watery environment. What would happen? What do you think would happen if you remove the water from a cell? What would happen to the cell?
It will die.
And why would it die? Based on what I just told you. Because, yeah, because of the fact all these reactions which are necessary for life, they would stop because they need the water in order for them to continue. So when you look at glycolysis, glucose being broken down, glucose to fructose, fructose 6-phosphate, fructose 1,6-diphosphate, all the way down to pyruvate, and then shuttle it over to the mitochondria. All those reactions would just stop. And when all those reactions stop, you get a backup. You no longer will be producing ATP, which is the basic unit of energy. And therefore, what would happen to your body if you're not getting energy? You see, sometimes you just wake up in the morning and you don't feel to get off the bed. Yeah, that's a lack of energy, right? And that's what happens at the level of the cell. And remember, cells make up tissues, organ system. When things begin to shut down at the level of the cell, you have this domino effect. So it moves on to the tissues, move on to the organ, and you just feel very, very tired. Very, very tired, and you don't feel to do anything. So that is why, very important, keep moisture, basically because all the reactions which occur within the body associated with metabolism, that is the things necessary to keep you alive, they occur in a watery environment. You remove the water, boom, that'll be equivalent to death. And in fact, very interestingly, when you remove the water, that's one way of preserving things. So anybody familiar with saltfish? Anybody here like a bacalao and onion with some sweet pepper?
Of course.
Yeah.
Yes, I love
I was not going
saltfish.
to call out on my foodie and see Kavita answered good. Yeah. So why do they use salt to preserve? Why is it then that if you put something in salt, when you look at the fish, they put a lot of salt in there, it doesn't decay, but it remains, just like how it is. All the tissues remain there, but they don't decay. Well, you have to remember, in terms of decay, we're talking about bacteria. Bacteria, what do they do? Now, one of the things you have to remember, when you're alive, your body is constantly at war, all the time. There's never a time when your body is not fighting off invaders. It does it all the time. However, when you die, right, your immune system no longer does the things necessary to keep these invaders at bay. So what happens, these invaders, like bacteria in particular, they begin to multiply. And when they multiply, they need food. So now they begin to devour your tissue. And that, in terms of after they devour their tissue, they give off waste product. And this waste product is associated with the foul smell, which we know when things begin to decay or break down. But it's only when bacteria now, they increase in numbers and they begin to consume or break down all of the tissues, they're literally eating you, and they give off waste product, and that waste product is what gives the foul odor. So one of the things, what you do when you put salt, now remember these bacteria as well, for life, they have these reactions which occur. And in putting the salt, what you do, you pull water out from the bacteria. And in pulling the water out from the bacteria, you kill them. So salt is a way of actually killing infection or killing bacteria. So because of the fact, with your knowledge of salt, do you know then that, is there any situation where you use salt when you have an infection in your body? Anybody could think of it? Where you use salt or salt water?
So in your teeth?
Yeah. I don't know if how many of you might hear your granny or somebody else telling you gargle with salt water if you have a sore throat. What a sore throat is, it's a bacterial infections of your tonsils, right? So you do have bacteria in the tonsil area, or it could be in the lower esophageal region, right? So what you do when you're gargling with salt, here it is, you're introducing something that could dry out these bacteria. And that is why gargling with salt water, particularly in the oral cavity, is a very good means of cleansing the oral cavity. Or if you have like a sore throat, is a good way of killing the bacteria there. So salt, always remember that it's a very good way of keeping wounds clean. Now, however, there is a side effect of salt. Let me ask you this question. If you get a cut, anybody ever get a cut and put salt in it?
Yeah.
Yes, it burns.
What happens?
It
It
hurts.
burns.
Yeah, so that is one of the side effects, right? So one of the side effects is that burn. So which is why, when you're gargling with salt water, yes, use salt water, but of course, temper it. If it is, let's say, a wound in your mouth, you might be able to do it for extended periods of time. But do know when you do it, you are helping yourself out, okay? All right, let's see if we could finish those organ systems. UNSLIC. What does the C stand for?
Cardiovascular.
Oh, very good. Is that important?
Yes, it
Yes,
is.
sir.
Uh-huh. And your heart, and what else? It's your heart, and what else? Cardiovascular.
Blood.
So cardio refers to heart, vascular refers to the blood, and what else? Veins, and what else? One more begins with A.
Arteries.
Yeah, so veins, capillaries, arteries, blood, and heart, all of those things come under the cardiovascular. And you wouldn't speak much to it now. You'd look more at that in SNF2. Right, that's actually the first topic that you look at, the cardiovascular system. UNSLICE.
Endocrine.
Endocrine, right? Those are hormones in the body. Somebody mentioned they're very interested in reproductive, or they like reproduction. So there's one hormone. Normally, in terms of feedback mechanisms in the body, we have a negative feedback mechanism set up. What does that mean? Well, it means that the more you secrete a hormone, it causes a decrease in the action that it affects. So the more you put out a particular hormone, it decreases the effect. However, there's one hormone in which you get the reverse. The more you put it out, it actually causes more of the effect to happen. And it's related to reproduction, and it's called oxytocin. And anybody, what does oxytocin do as it relates to childbirth? What do you think it does? It's something with the uterus. It causes it to expand or contract.
Contract.
Very good, yeah. So during childbirth, oxytocin is released. It causes uterine contractions. And the more oxytocin you release, more contractions. And what does the uterine contraction, what does it cause? It causes a little bundle of joy to come out, yeah? Little bundle of joy. So that's one of the critical things. But that's one example, and one of the few examples in the body in which you have a positive feedback mechanism. So do take note of it. That's usually another favorite multiple choice question. Okay, UNSLICED, digestive system. What does the digestive system do? Give me in three words, tell me what the digestive system does. It breaks down what?
Solid foods.
Food, that's it. Break down food. That's all it does, break down food. And why do we eat food? Why is food necessary? Energy, thank you very much. Yeah, that's why.
Get energy from it.
Correct. And that's a major reason we do eat food, to get energy from it. I hear what some people are saying, so, well, it could also get certain nutrients important for your immune system. Yes, that part is true. But the major reason why is to get energy. Good. UNSLICED. R. What does the R stand for?
Reproductive.
We mentioned why importance of reproduction already. What does the second R stand for?
Respiratory.
Respiration. Why do we need to breathe? Do we need to breathe?
Yes,
Yeah,
we
to
do.
live.
Into or
Deliver
respire.
oxygen to your blood.
And what do we use that oxygen for? We just mentioned it not too long ago to relating to digestion. What do we use the oxygen for?
Energy.
BDF.
To break down food.
Thank you. Yeah, I don't know. You might you might have looked at it in a different way, where you see this reaction where you have a sugar plus oxygen giving you carbon dioxide, water, and energy. You all remember that equation?
Yes, sir.
C6H12O6 plus 6O2 giving you 6CO2 plus 6H2O plus energy. But in essence, it's sugar plus oxygen gives you carbon dioxide, water, and energy. So we use oxygen to help us break down food. That's a major function it does. So we take it and we have a whole system, dedicated organ system, the respiratory system. But the main reason we take that oxygen and we break down food. That is a critical thing. And we break down food in order to generate that ATP or energy. And that energy now is used for everything in the body, any and everything. For muscle contraction in particular, the muscles need ATP to contract. And as we looked at, that muscle contraction interacts with the nervous system and the skeletal system to bring about movement. So everything is interrelated. as it were. Very important where that is concerned. The last one now, M. What organ system is that?
Muscular system.
Muscular system, which we mentioned already. All right, good. Let's go forward. All right, so here is us showing in terms of the environment, when we look at astronauts, is always important maintenance of a constant internal environment. When we think about a constant internal environment, keeping it at certain levels, when we breathe in the air, it has about 16% oxygen, 72% nitrogen, right? That's a particular, it always has to be at a particular level. That all of that is done in terms of keeping our internal environment constant. We need a certain moisture level. We need a certain amount of salt or saline in the body itself. All of these things contribute to something referred to as homeostasis. And the word homeostasis itself comes from stasis, meaning state, homo meaning same. So homeostasis means keeping a constant internal environment. Why is that important? See if you could throw back your minds to when you used to go to class at cont'd or in secondary school. When you go to a classroom, what do you expect to see? What are some of the things you expect to see when you go into a classroom?
Desk, chairs.
A desk,
student.
chairs, right? What else?
A
A
board.
teacher. What else?
Student.
Students. What else?
AC.
AC, most important, right? What would happen if you do go to a classroom? There's no desk, there's no chair, the AC not working, right? And we'll say no teacher. Now, will you be able to get through your work? Yeah, you might be able to, but it will be exceedingly difficult. So that, which is why you will be able to do it very hard, because imagine you have no place to stand up, no place to sit, and the environment, you're sweating, you have to be wetting, you have to be wiping yourself all the time, your face, to wipe away your perspiration. So that is why homeostasis is very important. Keeping a constant environment. You have your chairs, you have your desk, your AC, you could go, your table, you put your things there, you could take out your laptop, you have internet connection, and you could begin to do your work in comfort. Same thing with your body. It needs certain things always to be present in order for it to do its work properly. You need certain amount of nutrients, and most critically, those nutrients, give you energy. So all of those things contributes to what is known as homeostasis, maintenance of a constant internal environment in the body itself. So this is just something about in terms of gradients, and I wouldn't spend too much time on this, except to say, when you're looking at the movement of things, how does things move? For those of us, everybody here familiar with High Street in San Fernando?
Yes, sir.
Yes, sir.
Yes, sir.
Which way is easier to go? From Library Corner down to Courts, or from Courts to Library Corner? Which way is easier? Which one is easier to do? Or Courts is at the bottom of High Street, at the bottom of the
Library corner to Courts.
Courts.
Right, yeah. And similarly, in the book, because going the other way, you're going uphill. So therefore, you burn a lot more energy. Similarly, in the body, there are certain things in terms of how they progress. It makes it easier for it to be done or accomplished. And that is one of the things you have to appreciate as it relates to certain reactions, for instance, right? Certain things are favored one way over the other. And one example that comes to mind, and you will learn this in different courses, as it relates to salt and water. Usually, when you lose water, you lose salt. It follows, right? Or when you lose salt, water follows it. Could you give me some examples of that with your body when you lose this salt and water relationship? That when one follows the other?
Would sweating be one, sir?
Thank you very much. Yeah, right. When you lose, right? So you're losing water, and when you taste, when you taste the sweat, as it were, you see it's salty, right? And that's because that is one of the things. So one of the things, which is why whenever a person comes in dehydrated, to rehydrate them, when they give that intravenous drip, You ever look at the bag itself? What does the bag say? Does it say pure water or does it say saline?
Saline.
It says saline. And the reason why, usually when you dehydrate, when you become dehydrated and you lose water, you lose a lot of salt as well. Yeah. Anybody ever got a diarrhea?
Yes, sir.
Yeah. So, you know, when you sit down on your throne, right, and you're there, oh, and what happened? And you're all over your porcelain throne. But not only do you lose water, a lot of water is lost in the watery stools, but you also lose a lot of salt. So which is why, in terms of, always remember that when rehydrating persons, not only do you give water, but you give salt. Looking at babies, when babies become dehydrated, you usually, there's something that they sell in the drugstore. Yeah. Pedialyte, of course, that's a fancy one. Back in my day where they had G-Sol. Anybody familiar with it? Something that they sell in a packet?
Yes.
Anybody ever taste G-Sol?
Yeah, they have it flavored now.
They have it flavored now.
Yeah.
Back in
They
my
have
day,
orange ones.
we food. Back in my day was just in a packet and you had to mix it yourself, right? But if you ever taste it, it's salty. It doesn't. And one of the reasons why, because of the fact when you lose water, you lose salt. And we look at this when we look at the nervous system. What is the importance of salt? Salt is what is known as an electrolyte. It's a big word, but all electrolyte means it carries a charge. And that carrying of a charge is very important to the functioning of the nervous system. And we look at that when we look at the nervous system. If your nervous system doesn't have adequate amounts of salt, it will not function. And that is why when you are dehydrated and you lose a lot of salt, the nervous system begins to shut down. Now, which other two, we mentioned when you're looking at organ system, the nervous system interacts with which other two organ systems? Skeletal and?
Muscular.
Muscular. And which is why when you become dehydrated and you lose salt, the nervous system begins to shut down. And because of the fact the nervous system interacts with muscle and skeleton to be, in order to bring about movement, which is why when you're dehydrated, what happens? You just feel to lie down. You know, you don't get up and run anywhere. But you know, moving actually is very difficult because literally your body is beginning to shut down. And that is why when somebody is dehydrated, for rehydration purposes, not only to get in that water, which is very important, as you'll see as well, when you're looking at osmotic potential in cells to keeping that turgor pressure up, but more critically, getting back in that salt. So when you're looking at rehydrants such as Pedialyte, when you're looking at G-Sol, that is why they contain salt, right? Because of the fact you need to get in that salt, which is known as an electrolyte. It's just a big word that just means carrier of a charge. And when you're looking at it, you have sodium ions which carry positive, you have chloride ions which carry negative charges. So that's why salt is very important. In solution, salt breaks up, right? And then you get these charged ions. So now you're able to carry charge in the body, particularly in the nervous system. So when we look at the nervous system, you'll see that, more of that, in terms of those charges, the importance of electrolytes to the nervous system. Okay, we good so far?
Yes, sir.
All right, we're almost there, we're almost there. Fight them up, fight them up. Okay, so this is just an example here with homeostasis and President Reagan. Let's see if we could go through this. Now, President Reagan, he was a president of the US and he got shot. So what happened to him? Let's see, the bullet entered his lung. So what happens when the bullet enters your lung? What happens to your blood when you get shot?
It begins to flow out.
Right, it begins to flow out through that hole, right? So again, blood loss. Let me ask this question. How much, in terms of the volume of blood in our body, do we have a lot? Not really. About how many liters of blood do we have in our bodies? A, 2, B, about 5, or C, about 10 liters. Is it 2, 5, or 10?
About
5 to
five.
6. Yeah,
5.
it's not much. And when you think about it, you know them big Orchard Park? There's about 5 of them Orchard Park. Or if you're thinking about a 2-liter soft drink, is 2 of them and a small one, or it's 2.5 of a 2-liter soft drink. That's all the blood. It really isn't much blood. So the problem is he's losing blood. When you begin to lose blood, what happens? Your blood pressure. What happens to your blood pressure? Well, you're losing blood. It begins to drop, yeah. Right? And of course, as mentioned before, the blood is carrying oxygen to your tissue. So therefore, in your tissues, the oxygen levels begin to drop. That's in terms of the blood. Now, in terms of your lungs, right? Now remember, the bullet entered the lung. So you'd have impaired lung function. And in fact, depending on where it enters, you could have a collapse of a lung, right? So you have impaired lung function. So the major function of the lung in terms of getting oxygen into the blood, so therefore you have reduced blood oxygen. So the bottom line is tissues, all of the tissues, the oxygen level drops. So how do we fix that? Well, you give in. That's why one of the things you do, you hit up the person with oxygen, right? And that increases the breathing rate and increases your blood oxygen. That is important. And then of course you give IV blood. If the person has lost, remember it's only 5 liters. So you give IV blood and also fluids to get that blood tissue level back up, right? And once that is done, your blood pressure begins to go back up because your blood levels are going up. Of course, you would, what they fail to mention here is of course stopping the source of the blood loss, most critically, right? So if it is then, you know, you have a wound to the lung, you seal it off, right? To prevent pneumotaxis or the collapse of the lung. So most critically, once these things are done, the oxygen now begins to go back to the tissues. So as professionals, that's one of the things, medical professionals, that's one of the things you will see in your career, most definitely, persons coming in with gunshot wounds or puncture wounds to the lung, and you have to actually solve that issue. All right? Okay. We spoke about this negative feedback, and you will need positive feedback. Oxytocin, more is released, as we mentioned, to get the bundle of joy out. All right. Directional terms. These are some things that you will have to commit to memory, and it also included in the list of things to do. You'd see the directions. All right. So here you have towards the front is known as anterior, and towards the back is known as your posterior or the dorsal end. We have somebody here who's a fisherman who fishes, yes? Who have their boat, the 17-foot pirogue.
Yeah, yes, sir, it's me.
Right. So what is the fin that if you catch a big fish, what is the fin on the back of the fish known as? Is it the ventral fin or the dorsal fin?
Dorsal.
Right, correct is right. And that's why it's on the back. So similarly,
Yeah.
you know, the posterior of the fish, if you think like there's a fish, the dorsal fin would be over here. And so similarly, when in terms of direction, the posterior is known as dorsal. When you're looking at a human, using the midline or the waist, anything away from the midline is known as superior, and going away downwards towards your feet is known as inferior. Could you think of a vein that brings blood to the heart that is known as either the superior or the inferior VC?
The vena cava.
Vena cava, correct is right. So the superior vena cava, it actually returns blood from areas above the heart, whereas the inferior brings back the blood to the heart from areas below the level of the heart. All right, so the superior, that's why it's called superior and inferior vena cava, respectively. All right, proximal and distal. And again, here we're looking at proximal, distal. Proximal nearer to the point of attachment. So the point of attachment will be the shoulder joint. So as you move here, proximal will be getting closer to that area. So you would say that the elbow is more proximal than the hand in relation to the shoulder joint. Distant means further from the point of attachment. If you're looking at the knee or the patella and the ankle joint, you would say then that the ankle is more distal than the patella because the point of attachment is, of course, the hip. All right, so this one is further away than the knee in relation to this joint here. Two other terms, medial and lateral. Medial means if you were to draw an invisible or imaginary line down the center of the body. This is the middle or the medial area. If you're moving towards it, that's medial. If you're moving away, that's lateral. So medial, you're moving towards the midline. Lateral, you're moving away from it. Okay. Right, now we come to planes and sections. Almost there. Frontal plane, any plane that runs vertically from superior to inferior. Sagittal, vertical plane that divides structures into right and left, transverse and oblique. Let's have a look at the image to see how it's a little clearer. So this is the transverse, is across. Sagittal, we have any persons here who Sagittarius, for those who follow the horoscope, all due respect to those who don't believe in horoscopes, but for those who do, we have any persons here Sagittarius? No Sagittarius, not an issue. But when you're looking at Sagittarius, anybody knows what's the symbol for Sagittarius by chance?
Yes, sir, I know.
What is it?
Like an arrow.
Okay, not okay, that symbol, okay, but it's also represented what?
It's half, yeah, it have an arrow or something.
Yeah, that symbol.
Half human, half beast.
Oh, you're talking about chimeras or is that half and half in terms of the structure itself? I thought it was twin Sagittarius, but I guess I was mistaken. But it's half and half. So whenever you think about, I'm glad you raised the point of half and half. When you're thinking of sagittal section, it runs down the middle, dividing you into two. One of the things you should appreciate is, this is the only way, when you divide your body down the midline, everything that is on this side is actually mirrored. It's like a mirror image on this side, right? Everything, all the organs, all the limbs, everything, if you divide yourself this way. So a sagittal section runs this way from top to bottom in that regard. Transverse goes across, right? That's very important to remember those two. And let's go on to the other one. So sections are important. Body regions, this is important as well. Thoracic, abdominal, pelvic, those areas are important. And of course, cephalic, referring to the skull. Cephalization means all of these things are associated with the head itself. Occipital, this becomes important when you're looking at the skeleton itself. This right here is the occipital bone. So the occipital area is to the back. How I usually remember it in terms of this one, anybody here know what an ox is? An ox?
A cow?
Yes, a type of cow,
Yeah.
right? And you know, one of the big things with ox is what? Oxtail. You know? Yeah, in terms of the meat, when you think about ox, you think about oxtail. And when you think of a tail, the tail is usually to the back. Anyhow, I use that line of logic always to remind me that the occipital area is to the back of the head. You know, I think about a tail coming out from the back of your head. So there's a nice way to remember that is the occipital region. All right, so do take note of the body regions here. Cavities. So what cavities do we have in the body? Well, you have your cranial cavity. And what would you find in your cranial cavity?
A brain.
Your brain. Very good. Right? Spinal cavity. What do you get in your spinal cavity?
Spinal cord.
Spinal cord. Let me ask this question. Is there a separation between your brain and your spinal cord? Or is there one continuous, is it like your brain has a tail?
Like one continuous thing.
It's one. What would happen if
It's like
there's a
a
separation on the spinal cord? It's like your brain have a tail. Yeah, it does. So all of this technically is your brain. Your brain actually runs all the way down to the base of your spine. What would happen if there's a separation? One word begins with P.
Paralysis.
Of some sort or the other. Very good. Right? So whenever you do have some type of, let's say a crushed vertebra or a severing of the spine, you would have some degree of paralysis. All right. This region here, thoracic cavity. What organ, important organ, do you find in your thoracic cavity?
Your lungs.
Lungs, very good. Yeah. Right? Heart and lung. Right. Which lung is larger, your left lung or your right lung?
Left. I mean right. Sorry.
The right lung is larger. Why is your, for a very simple reason, why is your right lung larger?
Because you have
Than
to
the
fill it
left.
with the heart.
Correct. Thank you very much. Yeah. So the left lung is technically smaller because you have your heart over there. So you know it had a kind of squinch up a little bit to make room for the heart. And that is why the left, actually a right lobe. How many lobes do we have on the right side? 2 or 3?
The right side of
Yeah,
three.
the right side have 3. And the left side has how many lobes?
2.
2. If you really want to get technical, it does have 3. But what you have, the second lobe is actually really small. And it looks like a little bit of a thumb, right? It's very small. It's squished down. But for all intents and purposes, it's 2. You have 2 lobes on the left side, and you have 3 on the right side. And the reason why the left lung is smaller is because you have to make accommodation for the heart itself. Diaphragm. Diaphragm is it important?
Yes.
Yes,
sir.
as it relates to respiration. Anybody ever get a cough, as it were, in the diaphragm?
Yeah.
You know, when you watch boxers, when they
kinda
hit to the
stop breathing.
midsection, oh yes, and you double over because of the fact you wouldn't be able to breathe properly, right? So that is diaphragm, very important. Then you have your abdominal cavity, which you have your parts of your major parts of your digestive system. Yeah. And the pelvic, your reproductive area is associated here as well. And then you have these two together, abdominal pelvic cavity, the entire region of these consisting of both the abdominal and the pelvic cavity is known as the abdominal pelvic region, right? Right. So last thing I would speak to in terms of the membranes. So around the lungs, you have a membrane, right? As you see going around the lung, both lungs. Around the heart, you have a membrane as well. In fact, it's a fluid filled. So you do have 2 membranes, and in between the membranes, there's a fluid. So here it is, you have the parietal pleura. There's fluid in here, the parietal fluid. And similarly with the cardia, when you look at it, you have the pericardium, which is the sac that goes around the heart itself, and there's fluid in there. Let me ask you this, why do you have this fluid and the surrounding tissue around both the heart and the lung? You have them there to prevent, one word begins with F and is associated with heat.
Friction.
Friction, yeah. Because remember, all the time your heart is beating top. Let me go back there. Sorry. The heart is beating, is moving, top, is moving in this area, mediastinum area between the lungs itself is moving.
So I have a question, sir.
Go ahead.
So if somehow your lungs and your heart was to cause friction, so what would be your symptoms, sir?
That's a good question. So in other words, if let's say they didn't have any pleural, let's say the pericardium, like in this case, is pierced and the fluid drips out, leaks out, and is now rubbing. What would happen? That's a good question. Anybody wants to answer that one? What would happen? What do you think would happen? If let's say the pericardium is pierced, fluid runs out. So now the heart is rubbing against the lungs and the liver, which is more distal to it in the dorsal area, and it's rubbing. What would happen? What do you think would happen?
The heart will be damaged.
Heart will be damaged. So when the friction begins, what would start a burst? Because remember, the tissue is rubbing, right? So what is that happening is the capillaries would start a burst, right? As it continues to rub, more and more capillaries, right, begins to burst. So you begin to hemorrhage. And when the hemorrhage becomes more and more severe, what happens to your blood pressure? Blood pressure will begin to drop because you're losing blood. So what does the heart do to accommodate that blood loss? When your pressure starts to drop, what your heart actually does is trying to get that pressure back up. So would it decrease or increase in terms of the beating?
Increase.
It increases. So your heart begins to pump faster. Now this is where you get into a very vicious circle. Remember, it's rubbing, right? It's causing, each time it rubs, more and more capillaries bursting eventually. You get surrounding veins being burst, arterioles, arteries being burst, you're losing blood and your heart is pumping even faster. Hemorrhaging is going up and up. Eventually, what would happen? You'd go into what? 5-letter word. When you have sufficient blood loss, your body goes into
shock.
You're going to shock. Yeah, you're going to shock. So one of the things, the reason why your body goes into shock as well is really to save yourself. So if you're in a standing position, what happens? You faint, you fall flat. And one of the reasons why you go flat or in the prostrate position is it puts less, the heart now is able to circulate the blood with less action or less activity. It doesn't need to work as hard to circulate the blood when you're lying flat as opposed to when you're standing up, which is why when you see persons in shock, they fall, they become unconscious. It's really a body trying to save itself. So the heart is probably realizing, good Lord, I can't really do this. Let me put this person down here. Boop. So you drop down. It then begins to shut off blood to the non-important areas as well, your arms and your legs, which is why it's good to put you in an unconscious state. And it's only concentrating in getting the blood where? Between the heart and the brain. Because with the brain, if it is, you lose blood circulation for between 7 and 15 minutes, depending on the person or the timing, your brain cells irreplaceably, they die off. So even if they do bring it back, you have some degree of issues with the brain relating, which could translate itself into many things, be it a stroke, be it loss of activity to certain parts of your body and so on. So to answer your question, if friction were to occur, ultimately person would go into shock. And if left unchecked, that hemorrhaging would prove fatal. Okay?
Thanks, sir.
That's a very good question. Okay, so pleural cavities, pleural membranes, very important. And of course, this is your quadrants. You will see this when you go into theater, right? So here it is, they retract they cut through the pericardium. Sorry, not the pericardium. They cut into the thorax. And what we're looking at is the different quadrants. So you have the right upper, left upper, lower, left and right quadrants. That's the abdominal quadrants. And now these are the regions. So those are the quadrants, but these are the specific regions. And do take note of them. It will be worth your while to commit them to memory. Umbilical region. Why do they call this the umbilical region?
Because there is where umbilical cord is when you're born.
Very good. Piggybacking on that. What is another name for your belly button? Using the root of this word. Your navel, but using the root of this word umbilic. What is another name for your belly button? It is your umbilicus.
Umbilical.
US. So umbilicus, your umbilicus is another name for your belly button or your navel. And anybody familiar with our outie? When some people have outie for belly buttons.
Yes.
Yeah.
Which is really a hernia, right? It's really pushing out on it. When you're a baby, could they correct it? What's a simple way of correcting for it? When you're now born, in a newborn, because usually they tie off and the cap's supposed to drop off normally and it remains normally flat. But with some persons, you do have a hernia in terms of intrusion of be it the lower digestive area into the skin. So it pushes out in that area, and that's how you get the outie, how it pushes out. What is a way when you're a baby, how could they correct it? Non-surgical, anybody familiar?
Leave it alone.
A coin,
Yeah, you could use a coin. No, that's why it's sometimes good, to have an old midwife, the midwife who, if you're living in a certain area or in a village, nearly everybody or half the village born, through her hands. They have, what they could do is take a coin. Well, these are 50-cent pieces. I don't have that anymore, but a big coin, and wrap it in gauze and tie it to the umbilicus, right? The protruding umbilicus. And, they'll instruct the mother, well, when you tie in the child, like every 2 or 3 days, change the gauze on it or what have you not. But incredibly, just applying pressure to it, by tying down a coin on the umbilicus, it could actually push it in, right? But
Also, recently I learned that it's best for you to leave it alone, because when you keep pushing and poking, you're making the hole inside get bigger, because usually it does correct itself.
Right. So which is why, very good point, and I agree 100% with you. That is why I prefaced it by saying, you know, it's always good to get like an old midwife or an old doctor who, because that was part of the training they actually went through, you know, back in the day. So they would actually have better knowledge of it. So you're quite right in terms of, I wouldn't say, you know, let's say you go to any physician and they tell you, well, strap it. No, but if somebody does have the knowledge of how they taught them back in the day, before quote unquote modern medicine come in, they will know exactly what to do in that regard. But you're quite right, because now what they do tell you is to leave it alone. But it could be pushed, it could be placed in, you know, it could be retracted by it. And one of the reasons, I know my sister, that happened with my sister when she was a child, right? That happened. She had an outie, and my mother's physician, Dr. Warner, well, he has long since passed, up in Tunapuna. He actually did that treatment on her, and it did go back in. But then again, the other thing is, it depends on who will tell you that, who will tell you not to do it. Is it a surgeon who told you that by chance, not to do it?
Yes, sir.
Yeah, usually the surgeons, they'll tell you that. They'll give you one out of two options. This is my opinion and not the opinion of cont'd. They'll give you two options, either come by them to do the surgery or to leave it alone. You know, that is my opinion, not that of cont'd, okay? All right, but yes, but in the literature, it would tell you, you know, not to interfere with it, but do note that there, and I'm sure it'll be interesting to look in the literature. So one of the things you could do, you could preface a search, put PubMed, retraction of umbilicus by pressure, and see there'll be papers written on it, you know, where persons have done qualitative analysis of the data, and then you could see if indeed, you know, leaving it alone is better than actually retracting it by applying periodic pressure to it. Okay, good. But thanks for bringing that to my attention. Let's go. Right. So, and that is the last thing I wanted to speak on there. All right, so what did we look at today? Well, we looked at the class itself. We had an introduction where we all introduced ourselves, and we spoke to the things which are necessary for the progress of the course in terms of logging into the e-classroom, looking under what must be done under the little section that says things to be done by the student. And we looked at that. And so you have to complete those things usually before the next class. It's usually quite explicit, but always have a read for the week, what needs to be done. We then had a look at our presentation today. And one of the things which we spoke on in terms of the form, function, and life, we spoke about anatomy and physiology. Then we spoke to one of the major things, characteristics associated with life, has to do with reproduction. And the reason why reproduction is so important is that without it, we will cease to exist. We mentioned in terms of function, the importance of the thumb, one of the major reasons that sets humans apart above monkeys per se is the articulation of the thumb itself. It is able to rotate in positions above 90 degrees. Then we spoke about the building blocks of life, talking about from atoms to molecules, molecules associating to form compounds, these compounds being found in cells, cells to tissues, tissues to organs, organs to organ systems, and ultimately the organ systems associating to form the entire human body itself. In terms of organ systems, we mentioned the 11 organ systems, which could be remembered by the acronym UNSLICEDRRM. We also spoke to the importance of the triad, the nervous system, the skeletal system, and the muscular system, important to interacting together in terms of bringing about movement. In the body, physiologically, in terms of function, we also mentioned how salt follows water, which is why it's important when loss of water occurs during dehydration that the rehydrant not only takes water or takes into account water, but also has in it salt. So when we do look at some of the topical or some of the familiar rehydrants, such as G-Sol, such as Pedialyte, even Gatorade, which could be touted as a rehydrant, we do see they contain electrolytes. Electrolytes is a big word meaning charge carrier. And when we're looking at the nervous system, the important charge carrier is salt, sodium chloride. Sodium carries a positive charge, chloride ions carry a negative charge. And we'll speak more to the carrying of charges within the nervous system when we look at action potentials. Actually, that comes up in 2 weeks' time. Then we moved from those organ system in terms of life. We mentioned homeostasis, coming from the word homo, meaning same, stasis, meaning state. Homeostasis refers to the maintenance of a constant internal environment. And this has to occur because of the fact that when you have a comfortable environment, then things could productively or efficiently be carried out. So homeostasis, very important. One of the things when you look at the body, more than 70% water, all of the reactions associated with metabolism, all of them occur within water. And that's why water is very important for life. And we spoke to the fact that how in terms of after the cessation of life, the immune system shuts down, and that causes, of course, the proliferation of bacteria within the body itself, which then destroys the tissues. This destruction of tissues then leads, of course, to the emanating of waste product from these bacteria. And this waste product that the bacteria gives off is what is associated with the foul smell of death, right? That's the waste product being given off. So homeostasis, in terms of keeping that water in the body, critical for life because of the fact all of those reactions associated with metabolism occurs in a watery environment. Removal of that water tantamount to death, which is why salting is used as a means of preservation. You're actually killing the bacteria and other things which could break down the tissue of, let's say, fish when you're making saltfish. We mentioned positive feedback. The only positive feedback mechanism within the body itself is the one associated with the ejection of the child during childbirth, during delivery. And that is done by uterine contraction brought about by the release of oxytocin in the body itself. More oxytocin release, more uterine contractions occur. We spoke about the directional terms in terms of inferior, superior, distal, proximal, all of those other terms. We looked at it and mentioned that. Then lastly, we looked at directional terms and body cavities. Okay, so that's about all for this class. Let me stop the recording.
Before you go, sir.
I'm not gone yet. No, I'm not gone yet.
Oh.
I just stopping the recording. Let me see.